County. On Wednesday, I, along with Mayor Frank Jackson and our Board of Health professionals, formally advised people to stay at home. Why did we do that? Because COVID cases, hospitalizations, and deaths are increasing like wildfire. The governor flew into Cleveland this week and warned that Northeast Ohio is on fire. What would we be doing if our county was actually being devastated by fires? We would bring every resource we could possibly have to bring to bear to put those fires out. We would make sure that our loved ones were safe and out of harm's way. That's what we have to do now with this virus. I have to believe that most of you watching and listening know someone who's been sickened with the COVID virus, probably more than just one person. You may know someone who's died. The virus is becoming more and more visible to us, and yet it doesn't carry the same visual weight that an out-of-control wildfire or a tornado or a hurricane or some other natural disaster would have. And that's one of the reasons why I think it's so hard for people to change their behaviors. But we have to change our behavior. We have to act the way we would in the face of any life-threatening emergency. We have to stop gathering with people outside our immediate households. We should only be going out to do essential errands and tasks. If we don't do these things, if we don't follow the guidance of our Board of Health, the suffering and the deaths will increase beyond belief. And you don't have to take my word for it. Listen to the CDC, which just told people to cancel their Thanksgiving plans, or our own hospital system leaders who are saying that they're fast becoming overwhelmed. This morning, Dr. Mihalovich from the Cleveland Clinic sounded the alarm. He said they're seeing 2.5 times more patients than at the peaks in March and April, with over 500 hospitalizations. And while their bed capacity is huge, they have more than 1,000 personnel off work due to COVID. That's huge. That's the risk. Not enough staff. And by the way, we're not the only county telling people to stay home. Summit, Franklin, Montgomery, Medina, Lucas have all also put out stay-at-home advisories. So we're not alone. This is not a drill, folks, not a fire drill. This is about personal responsibility. Mayor Jackson and I and our health boards spoke to that with our stay-at-home advisories. And the mayor and I are doing more. We've agreed to bring a group of community leaders together to share information and offer ideas to the governor to help stop the spread. Now, here's some good news. 2 vaccines are in development and seem highly effective. So right now we're in a dark tunnel with a light at the end. We have to get through this dark and uncertain time by putting one foot in front of the other. We have to walk to the light that we can see ahead of us. By walking together, we will get through this. In the coming months, we'll have a vaccine, and life eventually will return to normal. But until then, we have to take this narrow, sometimes dark, and very difficult path. It's the only way to get through. Now, for many of us, this time is not just difficult because we're being asked to change our habits. Many business owners in our county have suffered terrible losses because of the virus. To try to help, we released 2 rounds of small business stabilization funds this spring for a total of $3 million. Those funds were distributed to 951 small local businesses. About half were minority owned. But we know the need is still great. So today I'm announcing a 3rd round of funding of $4.3 million to be given out as grants up to $10,000 each. This new round will open on Monday, November 23rd at 10 a.m. The program will run through Thursday, December 3rd at 5 p.m. Businesses should go to Cuyahoga County.us Stabilization Fund or call to apply at 216-452-9714. You can see those on your screen. I'm very grateful to Cleveland Neighborhood Progress, which partnered with us for our past 2 rounds and who are once again administering this round of funding for us. And we have another program that we recently funded that I want to make sure people know about and use, and that's our Public Utility Assistance Fund. We know in these hard times that people are having trouble paying their utility bills. So we've partnered with Cleveland Housing Partners to help residents financially affected by COVID-19 with their utility bills, like water and sewer, gas, and electric. This funding is income-based and only available until the end of the year, December 30, 2020. Please go to cuyahogacounty.us/assistance and click on the Utility Assistance button at the top of the page, or call 833-377-7368, 833-377-7368. While the coronavirus roars ahead, we have another serious, often deadly health crisis: mental illness and addiction. Like COVID, it stealthily attacks, often destroying lives. But unlike the virus, there's no vaccine cure on the horizon. When police pick up someone suffering from mental illness or addiction, often for minor crimes like disturbing the peace, there's often no good place to take them. So the police in many cases take them to jail. Our jails have been the biggest repositories for people with mental illness and addiction. And yet jails are not the right place for these folks to get treatment. And then to further shatter their lives, they wind up in the criminal system with a record. Today, I'm excited to announce the culmination of years of work, the creation of a diversion center, a place for crisis intervention, stabilization, and treatment of people with mental illness and addiction. Police around the county will receive crisis training from the Adams Board to identify people eligible for diversion and to de-escalate situations. They'll also have access to a 24/7 phone line operated by Frontline to answer questions and provide immediate advice to law enforcement. The Diversion Center initially will be located at 55th Street in Euclid, operated by Oriana House, under the supervision of the Adams Board. This initial facility should be open during the first quarter of next year. At the same time, we'll continue to evaluate other sites for a permanent location. The Diversion Center with 50 beds will provide treatment for up to about 9 days. Then the professionals will provide referrals for longer-term treatment to experienced community organizations. Lots of folks in the county deserve thanks for helping to make this happen. I know I'll miss some. I apologize to them in advance, but in no special order, I especially want to thank Metro Health, the Adams Board, St. Vincent, Frontline, Oriana House, Prosecutor Mike O'Malley, the drug court judges, County Council, the Public Defender, GCC, Cleveland Clergy Coalition, and Pastors in Mission, Rick Chiricosta, Andrea Hogben, and Medical Mutual, Senator Matt Dolan, and all our state legislative delegation, and Councilwoman Phyllis Cleveland. And most importantly, Council President Dan Brady, who's been really a long supporter of this program. Driving this project within the county administration, Bob Triazzi, who got it all started, Michael Dever, Brandy Carney, and Bill Mason, Chief of Staff for the county. They made this happen. I'm so excited because this project will change criminal justice in Cuyahoga County. Treatment for mental illness and addiction will be vastly improved. The jail population will be reduced, and we'll be enabling people to break free of the cycle of incarceration and to join the community as productive citizens. I'm going to turn it over to Terry Allen now, but we're missing our briefing next week because of the Thanksgiving holiday. I know it's going to be a different Thanksgiving for all of us, but one thing I want to leave you with is this. I'm so grateful for all that you are doing, all of you, to keep your neighbors, your family, and your friends safe. I'm so grateful for the people of this wonderful county. You're strong, you're resilient, and you're kind. As I said on Wednesday when we announced the stay-at-home advisory, if we take care of each other as well as we are all being asked to do, then next year, when we're gathered together for Thanksgiving, and hopefully we'll be able to gather together next year for Thanksgiving, we'll truly have something to be thankful for, the health and the lives of all those we love and care for. Thank you.
Thank you very much, Armond, for that vision for the future for next Thanksgiving. We all hope that we're in a very different place come that time. I think the Diversion Center is a fantastic opportunity for the community. And we know that COVID has exacerbated mental health and addiction in this community as well. The anxiety, the pain that folks have been facing, certainly this is a welcome opportunity for help folks to a better future. So thank you for that. We also thank you for your leadership, working together with Mayor Jackson and our other communities on the public health stay-at-home advisory. We know that yesterday, Governor DeWine reported 3,829 hospitalized COVID patients in Ohio, with 943 of those individuals in the ICU. These are the highest patient counts Ohio has had during the pandemic, and more than double the hospitalizations recorded during previous peaks. While statewide testing has increased by 43%, positive cases have increased by nearly 300% in the past month. We've heard people say that the increases are relative to additional testing. Clearly, the 300% increase in positive tests given that time over the past month is a clear indicator that we are surging. We know Franklin County reached level purple yesterday, with indicating severe exposure and spread, and now all 88 counties remain at high incidence as defined by the CDC. And for the first time, no counties are rated below level 2. The governor said that, quote, "Make no mistake, almost all counties are seeing more cases and more healthcare use that could threaten the medical system if they continue. Here in Cuyahoga County, it is the same story, I'm sad to say." Last week, the positivity rate for COVID testing among area hospitals was 15%, and it continues to rise, unfortunately, and you'll hear about that from Dr. Gullett. We also are seeing increases in our nursing home positivity rates as well, and you'll also hear about that. Those are our most fragile citizens. We reported our similar dramatic increases in cases over the last week, with between 400 and 600 cases reported per day so far this week in our jurisdiction. We've been averaging about 520 a day until today. Today, we received 750 cases, an all-time high for us in our jurisdiction alone in suburban Cuyahoga County. For each case, there are 2 to 3 contacts, and so these are very, very big numbers, and this is serious business. We've also seen over 60 fatalities reported this month. As you know, Case Western Reserve University modeling has been occurring to try to help us predict the future cases in the community. And Dr. Johnny Rose has come on from time to time with these briefings to share those models. And the models indicate we could be on track for 1,000 to 2,000 cases a day in the coming weeks if these continuing and very concerning trends are what we'll be facing in the weeks ahead. And our staff are now forced to triage cases and contacts to reach the highest risk level individuals. This is now a challenge being faced by public health across the United States. We know hospitals are concerned, as Executive Budish said, about bed capacity and staff shortages due to illness, given the major surge across the region. Inevitably, we've seen data lags given the unprecedented nature of this surge. What is certain is that cases have skyrocketed, and we have to slow down this train to save lives. Consequently, as Executive Budish mentioned, we joined him and Mayor Jackson for the Public Health Stay-at-Home Advisory to stem the tide of cases in the community. We're joined by many urban counties, as Executive Budish noted, because they're releasing similar advisories because this trend is almost universal across the state of Ohio. And we know across the country we're seeing a surge. We have a duty and obligation as public health professionals to do all that we can to protect our communities, all we can. We hope that the curfew the governor has implemented will work to reduce exposure and illness, and the governor was recently here in Cleveland and voiced his support for the stay-at-home advisory and those of other urban counties in Ohio, which is consistent with his efforts to slow down the spread of the virus. Just as it's critical for us to work in partnership with the governor, the Ohio Department of Health, and our colleagues across the state, it's equally important for all of us to work in unison here in Cuyahoga County right now. We're faced with a major humanitarian issue here and a potential growing humanitarian issue, and we have to slow down the virus transmission now. We have to pull together and do everything we can to prevent further spread of the illness. And I beg you, implore you, everyone, to follow the personal protective measures we all know well. Wear your masks, not just at work, not just at the department store or the grocery store. Wear it inside if you're gathering with anyone. And we want small groups of people, as noted in the advisory, less than 10. We want you, as noted by CDC, and something we mentioned recently, that we're encouraging you, we're asking you to spend Thanksgiving with just your family and your household. And there'll be time to celebrate later once this threat has passed. Wash your hands, maintain 6 feet or more in social distance, and regularly clean high-touch services. And businesses, let folks work remote if at all possible. We think that'll also help to reduce volumes and potential risk in the workplace. The stay-at-home advisory is about protecting everyone's health and stopping the spread of the virus and preventing fatalities. We are now on a very slippery slope, folks. And I can't be more clear about the request to all of you to do everything you can to help. We all have that responsibility. And don't wait to get a call from the health department if you test positive. You need to isolate for 10 days and 24 hours without a fever, without taking fever-reducing medication, and your symptoms need to be improving. We also want our cases to contact those who have been in close contact with them. Reach out to the people you know that you've been within 6 feet of for 15 minutes, close up. And it doesn't matter if they had a mask. If you've been in close contact with them, reach out to them and tell them that they need to quarantine for 14 days. We need everyone to be part of the public health solution as we deal with these tremendous case volumes. And if you go out and get tested while you are in quarantine and you test negative, you need to remain in quarantine for that full 14 days because you could still become positive and infectious during that incubation period. So we need you to stay put for the full 14 days. It's been said that it's always darkest before the dawn. And I think we're in that dark period right now. And Armond talked about the glimmer of a vaccine available for us in the offing. That's something that we're working toward. In the meantime, we're here to protect the most fragile of all of us, those that are at risk for complications, those that are at risk for death, and the pain and suffering that everyone that is associated with those folks will also deal with in the aftermath, often unable to be at their side when they're sick in the hospital. We need to prevent as many of these tragedies as we can in our community. Lastly, with Thanksgiving up next week, we have a lot to be thankful for in the face of all this. Our hospital systems. I'm grateful for the public health partners here at the Board of Health that have put in time and time again, evenings, weekends, all hours, providing a range of tasks to meet this incredible surge of cases in this unprecedented pandemic. And we work together with our colleagues across Ohio, state and local health department officials, and those across the United States that are doing everything they can to stop this surge and prevent further spread of this virus. And we are all part of that responsibility now. We all share in that responsibility. It's always darkest before the dawn, and right now we need to push through this very difficult period, and we're counting on all of you to help us. Thank you, and we'll turn it over to Dr. Gullett.
Thank you very much, Terry. Thank you all, Executive Budish. We're very appreciative of your with us and the support you've given us since the very beginning. We appreciate the opportunity with you as we enter this really difficult time for our community. I'd like to talk about our data brief for a few minutes, and then I'm going to cover some additional items that we want you to be aware of for this Thanksgiving holiday week. First, on our data brief, we switched several weeks ago to a consistent MMWR week report. And so that is a very typical pattern for reporting public health. And so the data that you see in this brief, other than hospital utilization data, are ending the week of November 14th. But what we also want you to understand is that we have had a dramatic rise in cases between November 15th and today. That just-in-time understanding, we're trying to help you realize that we are in a very different place than we even were last week or the week before. Really, to be honest with you, when this started in March, I couldn't have imagined case counts of this scope and scale. So I want to walk through a little data to help you see where we're at, and then we'll talk about what this all means in a few minutes. In looking at our data brief, you'll see we're just under 20,000 cases for the CCBH jurisdiction. And that does not include the City of Cleveland cases, as our partners at the City of Cleveland report their cases out separately. You'll see we have just under 1,900 hospitalizations since the beginning of the course and 439 ICU admissions. And we do know that those have increased across the state, but they've also increased in our own community. And we have had children as well as adults admitted to the ICU. It's also important to take a moment to pause and remember the 720 people in our community. That includes the City of Cleveland and our own cases here, who we have lost. As I've said before, and I want to reiterate again, these are members of our community who are invaluable, who can never be replaced, and they have died in a very short window of time. These are families who are grieving, and we must respect and honor and support them in this difficult time. I also want to talk a little bit about the number of cases this week. You heard Terry reference a couple of days that were very high, and I want to circle back to that. Prior to this, we had never had a significantly high day. Early in July, mid-July, we had 175 cases in a day, and we thought, wow, that's a lot of cases, right? Well, November 14th, as you heard, we had 641 cases, and today, in the last 24 hours, 750. To put that into perspective, in two 24-hour periods, that's almost 1,400 cases. That is overwhelming the system. We have public health warriors here calling day and night, trying to reach as many people as possible. But it's really important that you understand we may not get to everyone as quickly as we'd like. So we need you to stay home, to please do what we're asking. When you're diagnosed positive, stay home, and we'll get to you as soon as we can, we hope, in a timely manner. But we want you to understand the scope of the number of cases that are flooding not just our health department, but every local health department in the state. That's a really important thing for the community to understand. We care about you, we're trying to reach you, but it may take us a little bit longer, despite having hundreds of people working on this. Moving down a little bit lower on our EPI brief, I would like to highlight two things here. Jonathan, if you could go down just a tiny bit more, thank you. On the race and ethnicity data, here you see the number of cases. This is just cases, this isn't hospitalizations, by race. And you'll see that there are 54% listed as individuals who identify as white and 28% who identify as Black. But I really want to emphasize that that is not representative of the race breakdown for our community. And in fact, you've heard us talk about Black-white inequity ratios before, and we continue to see our Black neighbors being at nearly 2 times the risk of COVID infection and hospitalizations 3.4 times higher than their white counterparts. We cannot lose sight of the importance of understanding the impact of racism in our community and how it's impacting COVID-19. So I just want to make sure folks understand we're continuing to watch this. We're continuing to use equity to drive where we test and how we figure out where testing needs to happen. But this is very concerning to us. As we become overwhelmed with cases, we are not taking our eye off the importance of equity in this moment. Moving over to the right side of the epi brief, I also want to highlight that while you see only 11% of our total cases from the beginning of the pandemic identified as healthcare workers, we are in a crisis of healthcare worker staffing right now. We have thousands of individuals who are healthcare workers who work in lots of different types of jobs in our community in healthcare, who have been either affected by COVID or they think they have it and they're waiting on results. You heard that from the previous speakers today. This is a critical issue for our community. We have great hospital resources, great outpatient medical resources, but if we don't have the folks to care for them because they themselves are sick, we cannot provide the level of care that everyone needs. So I don't want anyone to look at this and only say only 11% are healthcare workers. That's not the way it is in the moment, and we need to understand that. Finally, I wanted to talk about pre-existing conditions for just a moment. You'll see that 38% of our cases to date identify as having some kind of condition like diabetes or breathing problems or heart problems. But there are quite a few people with COVID-19 in both the hospital and in the ICU that also do not have those pre-existing conditions. So while we know some people are at higher risk from having complications and from dying, we also know that people without any of those things are also at risk. So I just want you to know every one of us is at risk, and we've got to protect one another. Moving on to the next page, really I don't have a lot to say about this. Back in the summer, I thought, wow, look, our numbers are going up. And now their numbers from March until October are dwarfed by the month of November. So you can see what a traditional epi curve looks like now. And what we hope is that this does not continue to rise. Again, remember that this epi curve is about keeping the surge low for our hospitals. We don't want to overwhelm them. They've done an incredible job so far keeping up with it. But when you see that rising, we increase the risk of the hospitals being overwhelmed. The next piece of the epi brief is our zip code map. And this is the traditional map. This includes the city of Cleveland data as well as our own. We partner with them for this map and we release it together. And you'll see the zip code numbers also included as we have traditionally done. On the next page of the epi brief is our weekly summary of the utilization. That means the number of beds that are used in our hospitals. This is a combined from all of the hospitals for Cuyahoga County. And you'll see that the utilization of ICU beds and adult medical beds still stays around the 80% range. You can see a little bumping from week to week. You can see the pediatric beds are staying anywhere from 35 to 50%. And our ventilators appear to be about 37% utilized this week. That's good news that we still have available places for people to lay when they're ill. But that doesn't account for the people we need to staff the beds and take care of those who are the sickest among our community. We've got to protect our healthcare workers. So please do whatever you can to wear a mask and limit the number of times you go out and about that you don't absolutely need to in order to protect others in the community who we desperately need serving those who are the sickest. Finally, on the last part of our epi brief, we present hospital testing data. We have done so since March. What you see here is a comparison of the percent positive in recent weeks. This week is a very sobering high percent positive. We are at 20.5% positive, meaning of all the tests done in our community, over 37,000 of them among 3 hospital systems, Cleveland Clinic, Metro Health, and University Hospitals, 20.5% of those were positive. That's incredibly high. In comparison, last week, you can see on this epi brief, was just under 15%. And the first week of October, we were at 2.5%. So you can see in 6 weeks, the rapid rise. What this translates to is a high degree of spread of COVID-19 in the community. The virus is spreading out in the community at a very high rate. This is not just hospitalized patients. This is not just healthcare workers being tested. This is a broad cross-section of our community, and there are very high numbers of folks who are positive. In comparison, we've also been giving you nursing home data. The federal government began releasing this in August, and so we put it out for you as well in a summary table. You'll see today that nearly 25,000 cases were tested in our local nursing homes, both residents and staff, between October 29th and November 11th. That percent positive is a little over 10%. That in and of itself is also high. For comparison, at the beginning of October, our nursing home percent positive was 2.4, almost identical to the community percent positive. So this is yet further confirmation of the significant amount of community spread that we've seen develop in the last 6 weeks and really markedly in the past week. I mentioned earlier the high number of healthcare workers who are ill. And this isn't one system. This isn't just outpatient docs or inpatient docs. This is everyone who works in the hospital who's at risk, everyone who works in a clinic who's at risk. We need those folks. We need them to be there to take care of us when we get sick. So we're asking, please, even if you don't love wearing a mask, and none of us do, consider that you could be preventing an infection to somebody working in a hospital system or in a clinic who could be taking care of you or your family. We need you to do that. And doctors like me across the whole country are pleading for this. We need to pull together as a community. This is a really hard time, and it's gotten a lot harder this week. But there's a lot of shared humanity in what we do going forward together. We're Northeast Ohioans. I was born and raised here. We're tough. We're known for being tough for a lot of reasons. But we've got to come together and help one another through this time. I just ask that you would rekindle some kindness this week. We're all on edge. Earlier, we talked about mental health crises, behavioral health crises. All of us have been pushed to the limit. But I would ask you to consider doing something kind and in a COVID-friendly, safe way this week. An email, a text message, a FaceTime with someone, just to let them know you care and that you're here with them. The stay-at-home advisory was the work of our local and state officials coming together to layer a strategy that helps us get through this beyond what each individual one of us can do on our own. It was an opportunity to remind us to be vigilant and renew awareness given the increased numbers of this past week. So for each of us, that may look different, but it might look like reconsidering a trip to the store. Can you do 1 instead of 2 or 3? Think about all the ways you can protect your own family and those around you, including rethinking your gathering plans for the holiday, masking always and everywhere, washing your hands and sanitizing often, layering in all those things that help us stay safe, and using virtual means of communication whenever possible for personal or for work. I typically end with a moment of gratitude whenever I have an opportunity to speak at these press conferences, and this week is no different. I would, however, like to thank a few folks I've never had an opportunity to thank before, and those are our elected officials at the state and local level. I've been in public health a long time, having trained from the early 2000s, and I've never been through a pandemic like this. Of course, none of us have, but I have seen leadership come together this week in a way that has been really encouraging to me on the front lines. folks coming together, thinking about what do we need to do at the state level, what do we need to do at the local level, and what do individuals need to do? How can we do this together? And I'm really grateful for that leadership. And it's getting harder and harder on the front lines to stay the course. I had an opportunity to see patients this morning in person. It's getting harder, but we have to stay the course together. And I thank you for your leadership, and I look forward to continuing to work with you to get through this together. So as we enter the week of Thanksgiving, here at the Board of Health, we're grateful for the support of our community, and we ask you to stick with us. I don't know how long this is going to be, but we have hope on the horizon. A vaccine is not going to magically turn things overnight like a flip of a switch, but things are going to get better. We will get through this. We really will, but we have to help each other to do that. So please be kind, and please love one another, and please share a moment with someone this week to tell them how much you care. It will really help us all get through this together. With that, I'd like to turn it back over to Devin for questions.
Thank you all very much for your words. We now have some time for some questions from the media. As a reminder, please mute yourselves when you are not asking a question, and please identify yourselves and your media outlet when asking your question.
This is Lisa Ryan from 90.3 WCPN Idea Stream, and I'm curious, this question's for County Executive Armond Budish about the location of the Mental Health and Addiction Center, and I was just wondering how that was chosen and what went into that.
Thank you for your question. The Diversion Center is perhaps the most significant activity that's occurred in recent years in the county. A lot of work has gone into it, and if I might, I'll bring in Bill Mason, who's been spending untold hours on it. I think he's the best to answer your question. So with that, Bill, you want to come up for 1 second, take my spot?
Good afternoon, it's Bill Mason. Can you restate the question for me, please?
Hi, yeah. So I'm just curious about the mental health center and its location and how that was chosen and how that might help perhaps people in that neighborhood.
Well, it was chosen really by just, Armond, myself, Brandy, traveling around the downtown looking for a site that we can put this diversion center in. There was really no good fit anywhere. So we did eventually speak with Oriana, who has a building on East 55th Street that was used for housing. So it kind of was a pretty good fit. So we continued to look for other locations, but couldn't find anything. So we went back to that site, and we are going to make some repairs to it and use it as a diversion center for the next 2 years.
This is Jim Nelson with 19 News for Mr. Budish and Mr. Allen. It appears the Browns are going to allow some fans into the stadium this weekend, as they have for most of the season. Is that hypocritical? Does it undermine these stay-at-home advisories?
Thanks for your question. I know that the advisory doesn't explicitly address this issue, and I don't want to get ahead of the city of Cleveland, because obviously, First Energy is in the city of Cleveland. And so I would defer to them to address that issue in their jurisdiction as they would to locations in ours at this time.
If I could just real quick follow up, it stands to reason there will be people from within your jurisdiction who attend the game. Is that at all concerning, or does the fact that it is a large open air area, does that settle some of the concerns just from a general health standpoint?
Well, I certainly know that overall there have been a lot of considerations about spacing, and I know some folks that have gone to a few games, and the spacing is I guess, known to be good. They are outside, as you say. There's couldn't be more air circulation than outside, certainly at the stadium. And so I know that they've taken a lot of precautions, but as to, the specifics, I would defer back to the city of Cleveland. Remember, our advisory is just that. We want people to take as many precautions as they can. So people will have to make individual choices in an advisory like this. And if there's any further guidance from the city, they can provide that.
I would just add, if you've been to a football game, if you've been to the stadium, you see they've gone to great lengths to protect people, to space people, to make sure that to the maximum extent you can when you're bringing that many people together, that they're safe. Again, our advisories are meant to, they're designed around personal responsibility. People have to make their own decisions. We've given as much information as we can about what's going on in the community, and now it's up to each person to make their decisions.
Thank you. That's it.
Thank you. Are there any other questions?
Yeah, this is Dan Russ with Channel 19 as well. I'd like to ask about, we saw this in the spring with Cleveland Clinic UH getting some auxiliary bed space available. Has there been any coordination with the county at this point? Is this something you're looking at, rebuilding those auxiliary beds in coordination with UH and the clinic? Where are we in that process? I know we're pretty close. We heard from all three of the heads of major medical centers last week saying that if our numbers continue like this, by Christmas, we will be at our bed maximum in Northeast Ohio. So where are we in the planning stage of getting some auxiliary space available if needed?
I'm sorry, Armond, I'm going to defer to Dr. Gullett to follow up with you. Certainly. She'll be
You were
coming
breaking
here.
up a lot, by the way. It was hard to hear your question, but if I was hearing it correctly, and I'll let Dr. Gullett respond also. I've been in touch with all of the hospital leaders on a regular basis. They continue to tell me that they have space. They're not in need of setting up an alternative hospital, a temporary makeshift hospital at this point. However, they have emphasized and re-emphasized the difficulties that they're facing with personnel. That is the key here. When you have 1,000 people out, how do you make that up? And right now it's looking like it's getting worse and worse. So, and you can't build a temporary facility if you don't have enough staff to staff your own facilities. So right now it's not the facility space as I understand it, it's people. That's who we're trying to protect. Dr. Gullett, do you have anything you want to add to that?
Yeah, thank you very much. I agree with everything that you've said. And I would just like to add that we at the Board of Health and the Cleveland Department of Public Health meet on a very regular basis, at a minimum once a week, and often more often than that, with all of our hospital partners and the zone leadership. In those meetings, we have discussions about bed availability and capacity, about actual logistics of the way things are working between public health and clinical care. And we also have had ad hoc impromptu meetings about testing. I also know that they meet among themselves with regard to bed availability on a very regular basis, including, I think, at a minimum once a week as well, without our public health. They pull us in when they need us. They've been incredibly communicative with us, and the level of partnership that I'm seeing between our 5 hospital systems is really encouraging to me. And again, that's another thing that's really helping all of us to get through this, is seeing collaboration and partnership on an incredible scale. And that's what our community needs. And we want to make sure everyone knows that that's happening. We also, Terry and I also meet with emergency medical services, medical directors, as well as leadership of the fire departments once a week. And so that's another level of hospital collaboration pre-hospital. So all of those are happening on a regular basis, but we've increased the frequency as we've needed to with regard to surge.
And I might just add,
Is there any other questions?
I might
Oh,
just
go
add
ahead,
one
Armond.
last- I might just add one last thing, that Mayor Jackson and I have been talking with the governor, and we are going to be setting up a small group of leaders in the community, which will include the hospitals, to talk about where we stand and what we can do and what we need to do to protect the people of the community on an ongoing basis in light of the rapid increase in the numbers of infections.
Hey there, this is Amanda. This is Amanda Van Allen from News 5. I know you guys spoke a little bit about contact tracing and how that's been sort of a hill for you guys to climb because of the number of cases. Can you guys speak to that a little bit more and just maybe talk about what folks should be doing when they get a positive test? But also, do you guys mind speaking about testing? Obviously, testing is way up because cases are way up. So is there delays in people getting their results? Is it taking a little bit longer? Are lines longer? Can you guys just speak to that a little bit?
Sure. So I'll start, and then our Health Commissioner Terry Allen may have some other things he'd like to add. So I'll take the latter question first. So with regard to testing, we have worked really hard over the last probably 6 or 7 months when testing became a little bit more available. At the beginning, as you know, it was very limited. We've worked to build a testing infrastructure that goes across the community, meaning we're trying to create lots of different entry points for people in the community to be tested so that they're not going to emergency departments when they don't need to be there, but they do need to be tested. So we have a lot of community testing going on, and much of that has been funded by County Executive Budish, and we're incredibly grateful for that. Our Metro Health partners and the Board of Health run those regular testing sites, and we have seen increased demand, but we certainly have been able to meet that. We continue testing in outbreak locations whenever needed, and that's nothing that has changed. That's just the way it's been all along. Our nursing homes continue with their regular surveillance testing, meaning that they're testing their residents and their staff regularly, and you see us report out 25 to 35,000 tests each week when we report out their data. And then we also have a lot of community sites that are offering testing on their own. So the community health centers, you've heard on several of our prior press conferences, clevelandcovidservices.com is a place where people can go to be tested. And then of course, they can contact their primary care physicians at their hospital systems if that's where they go, who are now able to order ambulatory drive-through tests, and then also the pharmacies. I do know that a lot of the spots are filled, and I know I have some of my own patients who said, yeah, like I went online and there weren't any spots. But if you look at all of the different ways we've made testing available, we're still able to get people tested pretty readily. The turnaround times also continue to be acceptable within a couple days rather than 5 to 7 to 10 days like we saw at the beginning. And that's a testament to our labs and the incredible leadership of our lab physicians here locally and lab staff who've worked really hard to build capacity in the number of tests they can run. So I feel like we're still holding our own as a community with regard to that, and we do meet on a regular basis and more often if needed. If we start to identify testing concerns, we have the ability to do that. So that's the testing question. With regard to contact tracing and case identification. So when someone has a positive, you're notified by whoever took that test that you're positive. We would ask that you please isolate at home. That means you stay at home, if at all possible, in your own room, own bathroom, that you're not interacting with your housemates, whoever they are. We do know that household contacts frequently get positive tests as well, or they become symptomatic themselves. So protecting the household with as much isolation as you can is really important. These are the kind of things we tell you when we call. But given 1,300 cases on 2 days alone, we're not able to call you and maybe give you this information as quickly as we can. So we'd ask that you do that without hearing from us. With regard to contact tracing, we're continuing to evolve our strategy based on the volume. In a perfect world, we would be able to identify every contact, and we would be able to get to that person, explain their risk, get them quarantined for 14 days. Right now, we're pretty dependent on individuals notifying their own contacts to some extent. We're still working with a team of contact tracers from the state. They're doing amazing work, reaching thousands of people. But if you are notified that you've been a contact, we would ask you to quarantine at home. That means staying in your home, watching for any symptoms, contacting your personal health care provider if that's if you develop symptoms. And it's important for contacts to be tested. But as Terry mentioned earlier, if you're a contact and you get a negative result, you don't get out of quarantine before 14 days. You're still at risk for incubating and developing the infection and spreading it to other people. So the increased volume has put a tremendous strain on local health departments locally, across the state and across the country. But that's why it's all that more important for people to take it on themselves and to do what they know to do before we get to them. Does that answer the totality of both questions?
I might just add, if that's okay, Dr. Gullett, that
Absolutely.
the testing is critical. You know, if you don't know who's got the virus, how do you stop the spread? So testing is critically important. And as Dr. Gullett said, the testing time period to find out who's positive, what your results are, has come down. But even a day or two is still a pretty long time. There's now these things called rapid tests, which can give you an answer in 10 or 15 minutes. That's critical. There are times that you need to know quickly. We're funding $1 million more than we've already funded for testing for these rapid tests. We're going to try it out. But I will say that, you know, we would have funded more. They're just not available. There's such a limited availability of these rapid tests. So we've got our people out trying to get them. The Board of Health is helping us. Metro Health is helping us. And we're going to do what we can to get the testing sped up as much as possible to be as valuable as possible for this community. And I thank you for the help that you're giving us.
Well, thank you very much, and thank you all for taking the time to join today. If you have additional questions, please reach out to us and we will work to get them answered. This concludes today's press briefing, and we hope you stay safe. Thank you very much, and have a good day and a good holiday.
Hey, good morning.
When President Trump leaves office in just 68 days, he'll return to the world of average citizen, a world without special privileges and immunities of the presidency. And while President Trump has often been at the center of numerous lawsuits, tonight we take a closer look at the wave of legal jeopardy that could be on the horizon and why a controversial potential self-pardon might not solve every coming legal test. Here's Devin Dwyer.
Hi, Donald John Trump.
For years, Donald Trump has used the presidency as a legal shield.
The worst presidential harassment in history.
But outside the White House, a new reality awaits.
He's an ordinary citizen. Full stop. I mean, we actually had an entire revolution against the idea of kingly prerogative and the idea that a king is above the law.
No former president has ever been criminally investigated or charged with a crime. But Trump will leave office implicated in multiple active investigations into personal conduct from before the presidency.
There are credible allegations that Donald Trump has engaged in tax fraud, bankruptcy fraud, probate fraud, and that's unprecedented. We've never had an allegation of pre-presidential criminal conduct follow a president after he leaves office.
In New York, Manhattan District Attorney Cyrus Vance is leading a criminal probe into Trump's business practices. While Vance has not spelled out specific allegations of wrongdoing, he's seeking 8 years of Trump's tax returns. Last summer, the U.S. Supreme Court said Trump did not have immunity from subpoenas.
And there's no reason for the president's accounting firm, Mazars, or former accounting firm, to resist those subpoenas anymore.
How critical are those documents? What could they show?
The tax returns would be important for Cyrus Vance to explore, but probably triangulating those tax returns with other sources of financial information that he's been able to obtain or is still trying to obtain.
Trump is the first president in 40 years to refuse to release his taxes. According to the New York Times, decades of Trump's tax return data it obtained appears to show the billionaire businessman paid no federal income tax in 10 of the last 15 years. And starting in 2010, claimed an income tax refund of $72.9 million, which the Times says is now at the center of an IRS audit.
Actually, I paid tax, and you'll see that as soon as my tax returns. It's under audit, and they've been under audit for a long time. The IRS does not treat me well.
The Times also reported Trump has more than $300 million in debt coming due in the next 4 years, on top of $100 million tax payment due in 2022, and potentially $100 million more if he loses his refund battle with the IRS.
The amount of money, $400 million, is a peanut.
Trump's financial records are also at the center of a New York State investigation into possible financial fraud, as alleged by former Trump personal attorney Michael Cohen.
It was my experience that Mr. Trump inflated his total assets when it served his purposes, such as trying to be listed amongst the wealthiest people in Forbes, and deflated his assets to reduce his real estate taxes.
New York State Attorney General Letitia James is actively investigating Cohen's claims.
The outcome of the election will have no impact on our investigations, and so we will continue our investigations, again, related to the testimony of Michael Cohen. No one is above the law, and that our investigations have nothing to do with politics, but more to do with the facts.
Their aggressiveness in seeking additional information is indicative of the seriousness with which they're treating the allegations and of their conviction that the investment of resources will prove worthwhile.
Legal experts say Trump will soon likely face new subpoenas for documents and testimony. He last gave a deposition in 2016, just before winning office, in a civil case he brought against a former business partner.
I do.
Well, there simply is no immunization for a former president whatsoever. And we could actually see something we have never seen before in this country, which is the criminal trial of a former president.
And Trump's also facing fallout from allegations of sexual misconduct dating back decades. E. Jean Carroll, a former Elle magazine writer, claims Trump raped her in a Bergdorf Goodman dressing room in the mid-90s. No charges were brought, but after President Trump accused Carroll of lying, she sued for defamation. A federal judge this week said the case can go forward.
I have no idea who this woman is. This is a woman who's also accused other men of things, as you know. It is a totally false accusation.
Suffice it to say that his lawyers will have plenty of action in the coming years, and the criminal side of it may be the least of the concerns.
There's also a new lawsuit from within his own family. Niece Mary Trump filing suit in September, alleging her uncle Donald fraudulently kept her from a financial stake in the family's business. The president has called his niece an opportunistic disgrace.
To be disinherited, to be shut out entirely from the wealth of the family, was to be told quite explicitly that you don't count and you are not loved.
As he enters the post-presidency, Donald Trump facing an unprecedented array of legal challenges. But one big unanswered question, whether the Biden administration will pile on.
I will not interfere with the Justice Department's judgment of whether or not they think they should pursue the prosecution of anyone that they think has violated the law.
I do believe that the Justice Department will be very leery of bringing prosecutions of a former president, especially when the results of the election have been so hotly contested by that former president.
Regardless, President Trump has floated the idea of preemptively pardoning himself.
And yes, I do have an absolute right to pardon myself.
A right not spelled out in the Constitution and never tried before. It also does not apply to state investigations like the criminal probe in New York.
Criminal cases, by and large, move somewhat quicker, and they're the ones that carry with them at least the potential for prison time.
So a pardon from himself or from his vice president would go no distance at all to exonerating him or immunizing him against those state legal proceedings.
Proceedings now gaining steam as Trump's former hometown becomes ground zero for his legal battles in the days ahead. For ABC News Live, I'm Devin Dwyer in Washington.
Our thanks to Devin.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.
Deep sea driving, I see.
Something like that.
Well, here's something else. With your Farmer's Policy perk, new car replacement, you can get a new one.
That is something else.
Get a whole lot of something with Farmer's Policy perks.
We are farmers. Bum, 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 bum. Good evening from Hofstra University in Hempstead, New York. I'm Lester Holt, anchor of NBC Nightly News. I want to welcome you to the first presidential debate. The participants tonight are Donald Trump and Hillary Clinton. This debate is sponsored by the Commission on Presidential Debates, a nonpartisan, nonprofit organization. The commission drafted tonight's format, and the rules have been agreed to by the campaigns. The 90-minute debate is divided into 6 segments, each 50 minutes long. We'll explore 3 topic areas tonight: achieving prosperity, America's direction, and securing America. At the start of each segment, I will ask the same lead-off question to both candidates, and they will each have up to 2 minutes to respond. From that point until the end of the segment, we'll have an open discussion. The questions are mine and have not been shared with the commission or the campaigns. The audience here in the room has agreed to remain silent so that we can focus on what the candidates are saying. I will invite you to applaud, however, at this moment as we welcome the candidates. Democratic nominee for President of the United States, Hillary Clinton, and Republican nominee for President of the United States, Donald J. Trump. Good luck to you. Mr. Trump, good luck to you. Well, I don't expect us to cover all the issues of this campaign tonight, but I remind everyone there are 2 more presidential debates scheduled. We are going to focus on many of the issues that voters tell us are most important, and we're going to press for specifics. I am honored to have this role, but this evening belongs to the candidates and just as important to the American people. Candidates, we look forward to hearing you articulate your policies and your positions, as well as your visions and your values. So, let's begin. We're calling this opening segment Achieving Prosperity, and central to that is jobs. There are 2 economic realities in America today. There's been a record 6 straight years of job growth, and new census numbers show incomes have increased at a record rate after years of stagnation. However, income inequality remains significant, and nearly half of Americans are living paycheck to paycheck. Beginning with you, Secretary Clinton, why are you a better choice than your opponent to create the kinds of jobs that will put more money into the pockets of American workers?
Well, thank you, Lester, and thanks to Hofstra for hosting us. The central question in this election is really what kind of country we want to be and what kind of future we'll build together. Today is my granddaughter's 2nd birthday, so I think about this a lot. First, we have to build an economy that works for everyone, not just those at the top. That means we need new jobs, good jobs, with rising incomes. I want us to invest in you. I want us to invest in your future. That means jobs in infrastructure, in advanced manufacturing, in innovation and technology, clean renewable energy, and small business, because most of the new jobs will come from small business. We also have to make the economy fairer. That starts with raising the national minimum wage and also guarantee, finally, equal pay for women's work. I also want to see more companies do profit sharing. If you help create the profits, you should be able to share in them, not just the executives at the top. And I want us to do more to support people who are struggling to balance family and work. I've heard from so many of you about the difficult choices you face and the stresses that you're under. So let's have paid family leave, earned sick days. Let's be sure we have affordable childcare and debt-free college. How are we going to do it? We're going to do it by having the wealthy pay their fair share and close the corporate loopholes. Finally, we tonight are on the stage together, Donald Trump and I. Donald, it's good to be with you. We're going to have a debate where we are talking about the important issues facing our country. You have to judge us. Who can shoulder the immense, awesome responsibilities of the presidency? Who can put into action the plans that will make your life better? I hope that I will be able to earn your vote on November 8th.
Secretary Clinton, thank you. Mr. Trump, the same question to you. It's about putting more money into the pockets of American workers. You have up to 2 minutes.
Thank you, Lester. Our jobs are fleeing the country. They're going to Mexico. They're going to many other countries. You look at what China is doing to our country in terms of making our product. They're devaluing their currency, and there's nobody in our government to fight them. And we have a very good fight, and we have a winning fight, because they're using our country as a piggy bank to rebuild China, and many other countries are doing the same thing. So we're losing our good jobs, so many of them. When you look at what's happening in Mexico, a friend of mine who builds plants said it's the 8th wonder of the world. They're building some of the biggest plants anywhere in the world, some of the most sophisticated, some of the best plants. With the United States, as he said, not so much. So Ford is leaving. You see that, their small car division leaving. Thousands of jobs, leaving Michigan, leaving Ohio. They're all leaving, and we can't allow it to happen anymore. As far as child care is concerned and so many other things, I think Hillary and I agree on that. We probably disagree a little bit as to numbers and amounts and what we're going to do, but perhaps we'll be talking about that later. But we have to stop our jobs from being stolen from us. We have to stop our companies from leaving the United States, and with it, firing all of their people. All you have to do is take a look at Carrier Air Conditioning in Indianapolis. They fired 1,400 people. They're going to Mexico. So many, hundreds and hundreds of companies are doing this. We cannot let it happen. Under my plan, I'll be reducing taxes tremendously, from 35% to 50%.